Thank you for attending this breakout session. This session is filled with powerful information to help improve your health and empower you. Radio Free 102.3 KJLH. We are you.
Well, ladies, you've been enjoying yourselves. I hope clicking around, navigating through on KJLHradio.com. It's our 21st annual, our big KJLH Women's Health Expo, and we are virtual again this year. Again, our theme for this year is your health through the lens of COVID. And everybody has been affected by COVID in some way or another. And these beautiful ladies, I'm so excited to be back with them because they are going to tell us the importance of why it's so very, very important to have insurance during this time with this crazy pandemic. And affordable insurance, not just insurance, but affordable insurance and quality healthcare coverage has never been more important, especially in communities of color as we are battling COVID. For many years, a trusted source for getting good health insurance and healthcare has been with Covered California. And I know that because I've seen these ladies' faces over the years with us, and you guys have been a true partner with us in helping make sure the family has been really taken care of. And it's a state agency. It was established under the Affordable Care Act. Everybody knows Obamacare, right? So everybody knows Obama. Thank you, President Obama. So today, our panel, we're going to talk about valuable information that you need to know. And some of this stuff, you've heard us talk about it before, but you really have to keep it in mind as you go along through with everything that's happening, everything in your mind that's happening with COVID. It's great to have you ladies come and share with us. So thank you for being here.
Thank you.
Ladies, it's all interactive here. Okay, so let me give some names again. Okay, so reacquaint you with our ladies. This is Lady Claudia Kitty Bustamante. Hello.
Hi.
She is Covered California's field manager in Southern California, and we thank her for being here with us. Sherry Johnson. Hey, Sherry. She's a very active certified insurance agent with Covered California who's there in Pasadena, one of my favorite cities of Pasadena. And then my girl, Margot L. Thomas. She is the CEO of Crenshaw Health Partners, Inc. in LA. Hey, Lady Margot.
Hello there.
Look, this is like a little girl's tea, right? We sit around talking.
Girl power.
We didn't have the tea or the little wine or something. We were home. But
when
ladies,
the restrictions.
Yeah,
when restrictions are lifted.
Yes. So ladies, you're at home and you're clicked in and you're tuned in, and we're excited about it because we really have some good stuff to talk about, a lot of great resources. And Claudia, I would love to start with you because everybody right now is talking about why it's so important for us to have insurance, but in particularly people of color, African Americans, we need it. Tell them why.
Well, as we speak, hospitals and clinics throughout the state are full of patients with COVID-19. Mm-hmm. And most of the patients that are hospitalized are African Americans, Latinos, and other people of color. So having good health coverage is extremely critical even now. Especially to help you get well if you do get the COVID virus, because as we know, we are still in a pandemic situation. This goes without saying if you have other health problems that need to be addressed, like diabetes, obesity, high blood pressure, heart disease, and asthma, for example.
Well, everybody's excited. Well, President Biden came through. But not just that, but some landmark legislation that he signed into law, right?
So we're talking about the American Rescue Plan,
which
is actually really great news for healthcare. This law basically expands upon the federal, I always mess that up, the Federal Affordable Care Act, also known as Obamacare. It makes having quality and brand name insurance more affordable than ever before, regardless of a person's income. And as I mentioned earlier, having good health coverage is so important right now, especially in this age of COVID-19. There are three important, go ahead, Ade.
No, go ahead.
I was going to say, there are three important categories and about 2.5 million Californians who can benefit from the new healthcare provisions of the American Rescue Plan, right? So these three categories are people who are currently uninsured and are eligible for the new financial help through Covered California, with many qualifying for even $1 health plan. So basically, they can get a health plan for $1. People who are currently insured in the Covered California health plan and are now automatically eligible for more financial help. And then the third category are people who are currently having health insurance covered directly through a health insurance company, but they are also now eligible for Covered California financial help for the first time. And they can save hundreds and even thousands of dollars by switching to a Covered California plan.
Now, see, I love to hear that. And that's where I almost interrupt you before you got everything out. I was like, when will the money kick in? When will the savings kick in?
So a lot of the savings are going to kick in at the 1st of May 1st. So if you have a Covered California health plan, chances are you'll find that your health plan costs are going to be reduced, right? If you do not have a Covered California plan, there'll be a lot more people who will have an opportunity to qualify for Covered California now that hadn't in the past as well.
Okay, now Claudia, though, what are the major benefits for having Covered California plans?
Well, the good news is that all Covered California health plans cover all COVID-19 vaccinations and testing at no charge. And also, any medical treatment necessary that someone may need due to COVID-19 will be covered at no charge or minimal co-payments. In addition, all Covered California health plans must offer essential health benefits, which is part of the question that you just asked, that range from maternity care and hospitalizations to preventative and mental health care. Free preventative health care includes annual checkups with your doctor, all immunizations, mammograms, and screenings for diabetes, cancer, and high blood pressure.
All right, I tell you what, those are all things that are needed, and Covered California has you covered.
Well, at Covered California, we're really committed to health equity. And to that end, we want to make sure that African Americans and other people of color know that all the great benefits are available to them, regardless of income level.
Yeah. And that's really good because, guys, when the pandemic came, everybody's afraid. Everybody's staying at home. They're not going to their doctor's appointments. Even when they don't feel well, they weren't going to get their appointments. And it's great that they can get this coverage that they may or may not have had before and get in and get those things done. The mental health is a huge thing with everybody going through it right now. Huh, Sherry, right?
It's so huge right now, and it's so necessary. It's nearly impossible for people to access those benefits on their own, where the doctors charge $250 per 45-minute session. If you have coverage, it is covered for your copayment. If you have Medi-Cal, and I really want people to start using Medi-Cal, because if you're eligible for it, there are benefits in it for you. They also will provide you with therapy.
Sherry, now you're in the trenches. You're getting the people coming in, and you too, Margo. So we're going to get to you too. But you're getting the people coming in, and everybody's kind of disheveled. Everybody's just trying to figure their way out with this. Some people have a lot less income that they had before, or maybe they were low income already. People don't have jobs. They've lost their jobs. Can they still get coverage? Can they still get this coverage?
There is something out there for every single person. The easiest way to get in touch with us is to call the 800 number, 800-830-1706. That's 800-830-1706, or click up there on the banner on the website.
I've been hearing about this website you guys have. You have improved it where folks can get around and navigate a whole lot better. And I love the fact that you just love us so much that you guys are going to have banners all over the website where we can click and get to you easy. Just like you said, right up here, ladies. Look, right up there.
Right up there.
There it is.
Right up there.
There it is. There it is. There it is. Okay, so what is the website? Give us the website. You're going to be right on our website, on our KJLHradio.com.
It'll be on KJLHradio.com. Click it. It'll take you right through to Covered California Shop and Compare tool, where you can register for an account and get enrolled there, or give us a call if you don't know exactly where you fit, where things are, how they're going to work. Give us a call so that you can have the peace of mind moving forward as to what's going to happen with your enrollment.
So okay, so let's say you don't have insurance, because people always think like nothing is going to happen to me. I never get sick. I do this. They talk. Boy, I tell you, people come to me and tell me what kind of herbs and concoctions they take in, and nothing's going to happen to them. So I don't need insurance. But why is it so important that we do have insurance? What will happen if you don't have insurance and you get sick?
I have a perfect candidate of what happened. I had someone trying to call to enroll back in December because his mom was going, you need to call and get covered. And he called me, but he never completed his application. But he did call me on March 29th after he tore his Achilles tendon, went to the emergency room, and they said, you have to have surgery. In this scenario, that he makes more money than is eligible for Medi-Cal. And in that scenario, that's his hospital bill that he has to pay for the emergency room without insurance coverage. We haven't gotten the bill yet. I'm estimating with the testing and everything that he did, it will probably be over $3,000. And so that's his $3,000 bill. Luckily, because of the Affordable Care Act, he was able to buy a plan the next day and pay for it and be covered on April 1st, even though this happened to him on March 29th, because there is no pre-existing condition. And so he has scheduled his surgery, and he will have surgery, and it will be covered under his health plan. If he was under the Medi-Cal threshold in the hospital, the social worker is able to grant emergency Medi-Cal to you if you're income qualified. So if something happens to you, you can get covered immediately. And I urge everybody to get covered beforehand, because nothing beats the peace of mind that you get when you already have coverage.
Boy, let me tell you, he is lucky.
Did he luck out? I made him say, thank you, President Obama.
Yeah. He can't listen to his mama.
Right, listen to your mama.
You can't even say good luck. That's God luck, okay? You know, like,
That's what I said.
Right.
Too.
like good luck. I'm like, oh, give me God luck. I need God's luck in this, right?
Yes.
Now, there are still some penalties, right? If you don't have insurance, are there still penalties for that?
Yes, there are penalties. So for an individual, an adult is $750, and that's for California specifically. $750 per adult and $325 for each dependent.
Oh my God.
A household could easily pay $2,250 for the coverage, but that's the minimum. You actually have to pay that number or 2.5% of your household adjusted gross income, whichever is higher.
Oh my goodness.
So if you're a cowboy renegade to go, we don't need insurance, my family is healthy, we're going kayaking, we're going swimming, we're going to do all of these things, and you don't need your insurance and you were healthy and didn't have an accident, that's great. But if you make $100,000 a year, you will pay 2.5% of the $100,000 in penalty.
Wow. Because let me tell you, the government is going to get theirs.
Oh, Uncle's gonna get his.
Uncle Sam.
Uncle's gonna get his, yeah.
Now, how do you enroll in Covered California Medi-Cal? How does one do that? Because
Call me.
But they always ask me, how?
Call us if you're unable to navigate through the website, and lots of people have trouble doing so. It's not a problem. That's why Margot and I are here. Give us a call at 800-830-1706, and we will help you assess where you're going to fit into the puzzle, what you're eligible for, and we will let you know what you need. All you need to do is give us your income information so that we can assess. And that is not last year. People say, you want me to give your taxes from last year? No, last year was crazy. Nobody knows what's going to happen this year. Last year was extraordinary in itself. And so what we want to know is, how much do you earn right now monthly? How much do the people that you file on your taxes earn in your household collectively? If your grandma lives with you and you don't file taxes with her, we don't need her information. So we just need the people.
We don't need to know about grandma right now.
We only need to know about the people that you file on your taxes with. How much money do you collectively earn together? And we need one of you to prove that you live in California by giving us your California ID. And the reason why we do that is because our state exchange is so awesome. Covered California is so awesome that people who live nearby want to come and get enrolled. You have to be a resident of California in order to enroll in our plan.
Well, I tell you, ladies, you're listening. I told you we have the best of the best in here giving you the information. Now, let me go to my girl, Margot L. Thomas, because this one here, boy, she always gives me something to do. I'm like, what? She is the CEO of Crenshaw Health Partners, Inc. here in LA. Girl, it's good to see you.
It's good to see you too.
Let me tell you, so when we were talking, and Sherry even tapped in on it, like, when I was saying, like, people always come in, how do you do it? How do you do it? And I've talked about even with seniors having to try to figure out how to get around and navigate this. If they don't have someone to advocate for them, it is a disaster. I feel so bad when I see seniors, I go and pick up my mother's medications and stuff, and I see them struggling to try to figure out what coverage they have or what they don't have. But you guys have a program, that Navigator program. Girl, bless your hearts. You guys are angels. Angels, tell us about that program.
Well, the Navigator program is a mandated program of the Affordable Care Act. So that's a wonderful program because we are here, as Sherry has stated, we are here to actually assist people who may not be able to navigate, using the term, through the computer system or through the healthcare system to figure out what they qualify for, what provider they should go to, how should they go about doing this, what are their essential benefits. We can answer those questions. We can also, as a navigator, as a part of the program, or let me mention that there's several dozen navigators throughout the state of California. So it's not just Crenshaw Health Partners, Inc. That's a navigator, but there are others in other parts of the state. But as a navigator, though, we are here to actually provide free assistance to help them through the whole process.
Well, let me tell you, it's so necessary and needed because I'm trying to help my mother and I'm confused. I'm like, okay, I need to call Margot. Now, you guys over at the Baldwin Hills Crenshaw Plaza, are you guys back in there yet with everything that happened in this COVID? Are you guys back and operating?
Yes, the mall was closed, so therefore we were closed. We are on the second floor inside of the Baldwin Hills Crenshaw Mall, or Plaza, I should say. And we are open as the mall is open. Our hours are reduced, but we're still functioning. We receive phone calls. There are people that can walk in, but when they come to us, just as when they come to the mall, they have to have on a mask. They must wear a mask. That's mandatory. And then they can rest assured that inside of our office, we have the protective equipment so that there are the death shields and, some of my certified enrollment counselors may be wearing gloves and they have on their mask as well and shields. So
y'all got the PPE.
PPE, yes, we've got the PPE going on, and we want to make sure that everybody is safe in spite of the COVID. So people can come into our office or they can call us and we can enroll them by the phone because Covered California understands and are working with us regarding COVID and all of the restrictions that we have. And we can also enroll people virtually for those that want to go that route as well. So the work is still going on and the mall is open as we are.
Oh, good. Now give me your number, Margot. Is it the same number? How can we get with you?
Well, it is, and I've been instructed to ensure that everyone goes through KJLH website to call Sherry and I, which is 800-830-1706.
All right, family. So you hear what they're saying. If you go through KJLH, you might as well go through your family to get to your family. Okay,
that's
so
right.
That's the best way to do it. Right. Call 800-830-1736. Is that right?
No,
1706.
1706.
Yes.
There we go. See, family, how I have to have these ladies backing me up with the right information. Say it again, Margot. Give it to me again.
800-830-1706.
Got it. Now, Margot, I know you are just rip-rearing to go and get, you guys were always in the community doing events, doing this, doing that, and COVID shut it down. So I know you just itching to get back out there. But the one thing I have realized with COVID and everybody else, everyone is getting creative on how they're getting their messages out, how they're getting their brands out. What are you guys doing over there?
Well, there's a number of things. Yes, our ability to host and to participate in community events have really been narrowed down tremendously.
Yeah.
However, there are still some going on. There were vaccinations taking place at the mall, but that's on pause because those vaccinations were the Johnson and Johnson.
Oh, okay. Okay. Got it.
Okay.
Mhm.
Hopefully, we will be able to be there with a table, with a covered California table, to answer questions and to let people know what they can do in terms of enrollment, and we can guide them up to our office once this resumes, and hopefully it will resume soon. Also, we have participated in, we've been collaborating
Mhm.
with other organizations. So we've been participating in the food giveaways.
Oh, yeah.
So we may have flyers that are put into the bags, but we also have a small table set up with a covered California tablecloth to again answer questions and guide people in terms of what they need to do in order to enroll.
Okay. So what can we do as communities of color to help encourage each other to get that insurance? What would you say?
We need to collaborate. We
Mm.
need to continue to collaborate. We have been collaborating and we need to continue to do that. And when I say collaborate, I'm talking about working with the churches,
Mm.
working with the local schools, and the faith-based and community-based organizations, which is what we've been doing, but it needs to continue. And we need to pool our resources to make sure that we are focused on improving the health of our communities.
Well,
So
I tell you,
that's
ladies,
the one thing that I can think of.
yeah. Well, ladies, I could sit and talk with you guys all day because it's like getting together with my girlfriends and just sitting down and talking healthcare coverage and how we can get the word out. I hope the ladies that are watching are really enjoying it as well and getting this information so they can take that back into their families, to their churches, and share that everyone, it may sound confusing with getting healthcare coverage, but Covered California makes it easy for you. And all you got to do is reach out. So I want to give you guys each a chance to kind of just share your last final thoughts before everyone gets a clicking again and hit and rewind to get the information and the number. Lady Claudia, Kitty Bustamante, what you got to say, sis?
Well, I gotta say that Covered California is really committed to spread the word and make sure that people understand that they have access to healthcare and that we are really committed to health equity. And that at the end, we want to make sure that all African Americans and other people of color, right, have access to great benefits that a lot of these health plans offer, and that regardless of income levels. So yeah, definitely. Like Margot said, collaboration is key. And our goal and our efforts are in collaborating with other communities of color and organizations, faith-based, et cetera, throughout the year and onward.
Well, we thank you for that. Miss Sherry Davis Johnson.
I want everyone to know that insurance is a financial tool. Mm-hmm. And you may not want insurance, but if something happens to you, you've lost the ability to use that tool to protect yourself, to protect your health, to protect your financial well-being, and to protect your family. And so we really need to get covered so that we can make sure that we're able to look after ourselves financially and wholly physically. That means mind, body, and soul. And there are programs within the health insurance plans that everyone needs to access just for self-care. Mm-hmm. And so go talk to a therapist. You can go to physical therapy if you're not feeling well, but the only thing standing between us and that American dream that's been elusive to communities of color is to be able to handle ourselves financially. And this is a tool that we have access to for as little as $1 in so many cases. For $1. And you can save. Yeah, $1. You can free your mind. Margot and I are here to help you free of charge. We are resources in the community. If we don't have an answer for you for whatever it is that you need, we will find a place for you to get that answer. I would like to say that there is a process for grievances and appeals. And those are the things that some people run into issues with, and they're not able to access the care that they need. There's a process that you can go through to get you what you need. everything is generically written with an ICD-10 code on it. And the insurance company doesn't know what you need specifically. There's a language that is spoken. I'm a retired nurse, and I will assist people in going through that process. I was a former case manager. And so I can help you get through the grievance and appeals to get what you need. The drug that may not have been covered under your insurance plan, there's a process in which we can go through to get that drug covered under your plan at a in-network cost.
Love it. I love it. Lady Margot Thomas.
Yes, well, to piggyback on what Sherry has just said, health is wealth.
Mhm.
I mean, if you don't have your wealth, what else do you have? Excuse me, if you don't have your health, what else do you have?
Right.
And even more importantly, I want to thank KJLH, you, Ade, for all the work that you guys are doing continuously. And thank you for inviting us to participate in this wonderful health expo. Let's all band together and be sure that we are taking care of ourselves and each other.
I love it. I love it. Let me tell you, ladies, I cannot thank you enough, because every time we call up on you to give information, wisdom, and resources to the family, you're always available. I got to give a shout out to my girl, Angie, because she makes sure everything comes together with Cover California. We certainly love her. And of course, ladies, you that are listening, I hope you're able to get this information. Use it to the best you can in your lives with your families. And just remember, Cover California has you covered, all right? They have you covered. Ladies, it's been awesome. Thank you so much for joining me. Now, is it time for wine now?
Time for wine.
Sure.
And if I may, plug that 1-800-830-1706 number.
Like, thank you so much.
Thank you, Ade.
On track with Off the Wine. That's 1-800-830-1706. Ladies, if you're watching, write the number down before you get to the wine. It's 800-830-1706. And if you've already gotten into the wine, we're going to put it up so you can come back and watch this again later. All right. Enjoy the rest
good.
of the
Thank you so much today. Thank you, KJLH.
Thank you, Ade. Thank you, KJLH.
Thank you.
The Radio Free 102.3 KJLH 21st Annual Women's Health Expo, brought to you virtually by the City of Long Beach and Fresno County Black Infant Health Program.